Social prescribing is a way frontline healthcare professionals can refer people to local, non-clinical services to help individuals take care of their own health. Community referral has been so successful with adults that a new pilot for younger people is underway in the UK. We went to find out how it's helping.
Teenagers and young adults in Brighton could be the first to benefit from state-supported social prescription. Recent studies showed a reduction in the use of NHS services by 80% of adults who'd been referred to a social prescribing scheme. Earlier this year, the government announced nearly £4.5 million for social prescribing. The Royal Society for Public Health has also developed a new framework to help professionals develop their knowledge.
Brighton and Hove is one of the areas chosen to receive government funding as part of a pilot aimed at finding out exactly how social prescription can help young people.
YMCA Downsink group here is one of 23 organisations across England awarded a share of this funding. They will use it to support a social prescribing scheme within the Children and Young People's Welbeing Service. Their work covers areas such as mental health, sexual exploitation, housing and counselling.
We know that nationally there is quite a strong evidence base for social prescribing in adults, and that the same thing doesn't really exist for children and young people. And part of this work is that we're looking at how we can sort of provide an evidence base. So our social prescribing role sits within a wider project we have called Mind the Gap. And the value of that project is about ensuring that young people don't fall through the gaps of services.
Social prescribing links non-clinical specialists deploying non-medical solutions with people in need of help.
The patient sees that link worker who finds out what their problems are, what their hopes are, what their expectations are, what their abilities are and what their challenges are, and mixes them all together and then finds something that will take them to a healthier level.
It feels really good because I know that I'm not on my own and I have people that I can talk to whenever I feel that I need help and that I'm struggling.
14-year-old Ellie-May Vaughan is the sole carer for her mother, who struggles with depression and anxiety and finds it hard to leave the house.
I guess I didn't really have enough time to do some of the stuff I want to do and go out with my friends, because it would be quite hard to just leave my mum at home and do whatever I want without forgetting about her.
Her school realised she was having difficulties and suggested she attend the local young carers group.
I was nervous to meet new people because it's always just been me and my mum. So when they told me that I was going to have to, well, I didn't have to, but I would meet new people who were like me, it was like, okay. And it was just quite nerve-wracking and scary.
She was then referred by young carers to Nicky Inckle from YMCA DLG's Mind the Gap service.
Nicky had been in the week before to our office to tell us about the service, and it just sounded amazing that they were able to allocate someone to work one-to-one.
And Nicky conducted a sort of thorough needs assessment with Ellie about what was going on in her life and what she felt she needed at that point in time.
I guess we just talked about it and how I was feeling, and then we'd talk about if we actually did it, would it make me feel better? And then it would be like, yeah, kinda, it would. And then that just kinda gave me more confidence.
We've been running the pilot now for about a year, and the successes are overwhelming. Like Ellie-May, who's gone from being at home a lot looking after mum to now being out and about in Brighton, accessing support through the young carers.
She's got a great social group and she's doing what other normal teenagers can do. Goes into town, meets up with friends, and she's a real sort of mentor now at our drop-in groups.
What effect do you think going to young carers has had on you?
I can talk to people, that's a good one. I'm more confident to go places on my own and more confident to talk to people who I know that will understand me. I want to help younger kids like me who are young carers.
Health workers emphasise that social prescription is not about being told what to do.
It's about having that open conversation with them about what they think might help them, and having that positive experience means that if in the future they are struggling, we think they're much more likely to reach out for the support again and ask for help.